Welcome to the deep dive. Today, we're taking a bit of a turn, moving away from markets and tech and straight into human biology.
We are. We're looking at prenatal movement,
Right.
specifically Pilates.
Right. And if you've ever wondered what separates a good prenatal instructor from a truly exceptional one, the answer we found in our sources is, well, it's pretty surprising.
It's embryology.
Exactly. A deep foundational knowledge of embryology.
Can I know, it sounds almost esoteric. Why on earth does the formation of a blastocyst matter when you're just, choosing a spring for a reformer? But our dive into this showed a really striking premise, a non-negotiable one, actually.
Which is?
You cannot design a safe, effective, or even an ethically responsible movement session for a pregnant woman without understanding those precise stages of embryonic development. The whole practice has to be anchored in science, not just intuition.
And the sources were so clear about this. They said pregnancy is not, and this is important, it's not just a slightly modified version of your usual workout.
Not at all.
So our mission today is to really unpack why that difference is so profound, to show how these precise biological phases, embryology, hormones, how they dictate every single movement choice.
Exactly. From the mat to the Cadillac.
Ugh.
We need to internalize that pregnancy is this magnificent succession of incredibly precise biological phases, morphogenetic, hormonal, hemodynamic.
So to underestimate any of that is a huge risk.
It's a fundamental risk. You compromise safety, you compromise coherence. It requires a total paradigm shift for the movement professional.
Okay, so a paradigm shift. If we're moving away from just counting weeks, we need to start thinking in what the sources called biological windows. Can you elaborate on that?
Think of it this way. Labeling the first 3 months as the first trimester is convenient, sure, but biologically, it's a massive oversimplification.
It's just a calendar term.
Exactly. A biological window recognizes that the body's safety limits, its structural priorities, they change dramatically, sometimes within days.
So give us an example.
Okay, so the first trimester isn't just about, feeling tired. That window includes organogenesis.
Which is the big one.
It's the moment where all the fundamental structures of the new human life are being set up. This biological window of high vulnerability, it dictates a need for prudence that, say, week 15 just doesn't share.
And this brings us to a really fascinating concept, which is rejecting the idea of the embryo as just a passenger.
Right. The sources insist on this. There is no embryo on one side and mother on the other.
So what is it then?
It's a living dyad, a system in constant, intense dialogue. The embryo isn't passive at all. It's actively modulating the maternal environment.
How? Through what mechanisms?
Through the creation of the placenta, through profound endocrine shifts, through changes to blood volume and flow. The embryo directly influences the mother's physiology. And that dialogue immediately changes her biomechanics.
So for an instructor, this isn't just about making room for a growing belly way down the line. It's about physical changes happening right away.
Immediately.
What's the most tangible way this diet influences her movement?
The most critical example is the hormone relaxin.
Okay.
Its production causes a generalized relaxation of ligaments and connective tissues throughout the mother's entire body. And that translates directly into greater joint laxity, more available mobility.
Wait, hold on. But isn't increased mobility usually a good thing? I mean, in movement practice, if she feels she can stretch deeper, shouldn't we encourage that?
And that is the crucial mistake. That is the very trap the sources warn us about.
How so?
When you have this generalized ligament laxity, the joints are inherently less stable. So if you facilitate a deep stretch, you're actually exploiting that newfound mobility instead of supporting the joint.
Ah, I see.
The instructor's priority has to shift completely. You have to aggressively prioritize control and stability over amplitude. Always. A poorly chosen spring setting can amplify that hypermobility, leading to joint shearing, sacroiliac pain.
So the goal is to organize, not to just push further.
Exactly. The movement strategy has to act as an organizing force, providing stability and feedback, not as an amplifier of laxity.
That reframes the entire practice. Okay, so if the body is actively changing its structure from the inside out, the instructor needs a map. What are the absolute, bare minimum biological stages an instructor needs to grasp to be responsible?
They need to understand the initial choreography of life. So we're talking about fertilization and cleavage, which is the first cell division, then blastocyst formation and implantation.
Right.
Then gastrulation, the formation of the 3 primary layers, and the really foundational stage of neurulation. And we have to translate these academic terms into movement imperatives.
Let's do that. Start at the very beginning. Cleavage. How does a cellular process like that resonate in a Pilates studio?
It's incredibly relevant. This initial cell division, it sets up the first embryonic axis, the antero-posterior head to tail, the dorsoventral back to front, and the right-left symmetry.
So life is literally organizing itself by axis.
Yes. And what is the fundamental principle of Pilates?
Axial organization, alignment, trunk stability, pelvic neutrality.
Exactly. The embryology confirms the very logic of the Pilates method. Life is built on sequential, organized axial stability.
And during this very early phase, what is the mother's experience telling us about what kind of movement she needs?
Well, huge maternal shifts are happening immediately. Intense fatigue, nausea, hormonal swings, and often a lot of anxiety. Her nervous system is already adapting.
So the movement has to reflect that.
The programming connection is clear. Movement has to be gentle. Heavy focus on breath organization, stability cues without a heavy load, and just encouraging circulation. You're stabilizing the mother systemically to support the incredible internal work.
Let's move to neurulation. The sources identified this as the most sensitive window for movement programming. This is where the foundation of the central nervous system is laid down. Why is this so critical?
Neurulation is absolutely foundational. The formation of the neural tube, the precursor to the brain and spinal cord, is incredibly sensitive to its environment.
Its environment being the mother's body.
Correct. So if we introduce excessive stress, high cortisol, or vascular constriction that limits oxygen delivery, we are potentially compromising this crucial process. The instructor's ethical imperative here is to reduce all avoidable stress factors, physical, respiratory, psychological, all of it.
Okay, so how does that translate into the Pilates studio? What are the hard rules for the neurulation window?
You must strictly eliminate any exercise that promotes a logic of performance.
No pushing for a new personal best.
None. No heavy springs that require max effort. And crucially, you avoid anything that induces high intra-abdominal pressure. So no intense sit-ups, no powerful core bracing, and especially no breath holding.
Because that can generate a stress response.
A stress response, and it can compromise circulation. We also put a hard stop on intense torsions or deep repeated flexions. The whole focus shifts to oxygenation, circulation, and just gentle postural organization.
That is a huge shift. It demands the instructor act as a highly tuned observer, which moves us into programming. The sources said instructors must work from principles, not recipes.
That's the most important takeaway. Pregnancy is variable, recipes are rigid.
So what are the principles?
The principles are universal. First, hemodynamic and respiratory security. Second, segmental stability before amplitude. Third, rigorously respect the ligament laxity and the shifting center of gravity. And above all, individualize based on her sensation, right now, in this moment.
Okay, let's look at the trimesters through that lens. First trimester, fatigue, nausea, it's often dominant.
The goal here is system support. Anchor the mother, focus on diaphragmatic breath, circulation. On the Reformer, you're using moderate springs, maybe even lighter than for a typical client.
Because the spring's job is different now.
Its job is feedback, not resistance. It's helping her find pelvic neutrality and axial alignment without asking for powerful control that her ligaments just can't handle yet.
Okay, what about the second trimester? This is often the window where women feel better, they have more energy, and they might want to ramp things up. But you called this a danger zone. Why?
Because of what the sources call the cult of amplitude.
The cult of amplitude, I like that.
Energy increases, yes, but relaxin levels were often still very high. The goal now is organized strengthening. We want to reinforce the posterior chain glutes, back scapular stabilizers, to prepare for the load that's coming.
But because she feels great, she might want to overdo it.
Exactly. She'll try to overperform, exploiting that ligament laxity. I've seen instructors push clients into ridiculously deep lunges, thinking they're helping, but they're just stressing the pubic symphysis or the SI joint.
So the instructor has to be the one to say no.
You have to actively refuse the desire for maximum range of motion and instead prioritize coordination within a protected range.
This sounds like a perfect time to use something precise, like the Cadillac.
Absolutely. The Cadillac shines in the second trimester because it allows for high precision and assisted movement. We can target deep stabilizers, work gently on the scapular belt, use light springs for arm and back strength, all without asking the joints to handle heavy load across a hypermobile range. It organizes the body without exploiting it.
And finally, the third trimester. The load is high, center of gravity shifted, breathing can be restricted. What's the core goal here?
Comfort, security, and preparation for labor. That's it. We're reducing amplitude across the board. The key caution here is avoiding the prolonged supine position lying flat on your back.
Right, because the weight of the uterus can compress major blood
The
vessels.
vena cava, yes.
Yeah.
It can lead to dizziness, shortness of breath, just discomfort. So we adapt.
What do you do on the equipment?
We shift everything to sitting, side lying, or semi-reclined positions. The Reformer is used with wedges or pillows to elevate the torso. The Cadillac is fantastic for supported sitting, gentle traction. The equipment becomes a support system.
This depth of knowledge carries a huge ethical weight. If an instructor just programs blindly, what are the concrete risks?
Oh, the risks are direct and measurable. First, you risk aggravating symptoms. Promoting inappropriate intra-abdominal pressure can make a sense of heaviness worse. Second, you can actively cause joint pain, SI joint pain, pubic pain, by ignoring the reality of the ligaments and forcing the joint to handle excessive load.
And what about the psychological side?
That's the third risk. You induce stress and pedagogical failure. If you can't explain why you're making a choice, you compromise her trust and her own sense of bodily control.
So how do you translate the complexity of, say, gastrulation into language that builds trust without sounding like a medical lecture?
Right. You don't give a medical course. You use the science for your own internal structure, and then you communicate the principles simply and truthfully.
Can you give me an example?
Sure. Instead of saying, we can't do that because of potential neural tube compromise, you say, your body is performing foundational work right now. We need to prioritize calm and oxygenation, so we're keeping the intensity moderate and focusing on smooth breath.
I see. It's about the why.
It is. You explain you're avoiding a position because circulation deserves comfort, or your ligaments are softer now, so we're focusing on stability to support your joints. That simple, factual, reassuring language builds immediate legitimacy.
And this whole conversation, it really boils down to one guiding principle, doesn't it? The ultimate golden rule.
It does. The one non-negotiable rule is this: never program for an imaginary pregnancy. Program for the real woman in the real moment.
Be a radical listener.
A radical listener and observer. If a movement felt fine last week but is uncomfortable this week, you adapt. Immediately. No questions asked. Knowing the biological markers allows you to progress with her body's needs, not against them.
And having this knowledge also elevates the professional. It allows the instructor to participate in the broader medical ecosystem.
Absolutely. When an instructor understands the exact biological constraints, why supine is an issue, why intra-abdominal pressure is a risk, they can speak intelligently to midwives, physical therapists, obstetricians. They become a conscious movement professional, not just an exercise technician.
So if we synthesize this entire deep dive, embryology isn't distant theory. It's a fundamental, a grid of responsibility.
It is a grid of responsibility. It is the foundation of quality prenatal programming. It teaches us that our job is to accompany the process without interfering and to support without overloading. Every choice has to have a physiological reason.
So it's about profound long-term well-being, not just getting through an hour-long session.
Exactly, setting her up for a powerful postpartum recovery as well.
Which brings me to our final question. If this structured, biologically anchored approach is the goal, what long-term measurable impact should the scientific community be exploring next to really solidify these standards?
That's the big question. I think we need to move beyond simply measuring pain reduction during pregnancy.
To what then? Postpartum outcomes?
Yes, quantifiable, long-term data on postpartum outcomes. We should be rigorously measuring the impact of intelligent prenatal Pilates on the long-term prevention of chronic lumbopelvic pain, on the quality of sleep, the speed of functional core recovery.
And the mother's own sense of control.
Critically, her long-term sense of bodily competence and confidence after birth. By measuring these specific, profound outcomes, we can solidify this informed, safe, and profoundly human pedagogy as the universal gold standard. That is the path to truly lasting change.